Hello, welcome back to the AQS Podcast, Data Voices, where we speak with the people shaping data in real life, where it meets impact and where it meets people. My guest today is someone who does more than communicate. He translates complexity into conviction and turns strategy into stories that save lives. Arnold Gachire is the communication lead at the Society for Family Health Rwanda. He's been at the front of some of the country's most public health campaigns, from HIV awareness to malaria, digital health rollouts with sun technology, and more. This conversation isn't about campaigns. It's about what it means to lead when the message is the mission. We're talking about navigating pressure, balancing truth with power, and how data, when told well, can shift systems. Hello and hi, welcome back to the AQS Podcast. This is episode 2, and I already gave you an intro of the guest that we have today. So let's Hi Arnold, welcome to the AQS Podcast.
Thank you, Misa, for having me.
You're welcome. So obviously we're going to dive into a lot about what you do and the mission that you're serving in SFH. But before we talk about the work, start me in a moment, like a place, maybe a sentence or something someone said that impacts the work that you do right now, like that still sits at the center of what you're doing right now in communications. Yeah.
Okay. Thank you for having me on your podcast. So if I take a look back, if maybe I understood your question correctly, a word or a sentence that takes me back to why I started contributing to this work?
Yes, and that also still fuels your maybe let's say your zeal for communication. What exactly is it that you look back to and you see this is something that fuels my work every day and that impacts my touch in communication.
So I think for me, I'll talk about why and what motivates me to be in this field. So growing up, I've always wanted to have a chance to contribute to empowerment and to change. So even when I track the jobs I've done in the last 15 years, all have a place in improving the lives of those who are less fortunate or those who are underserved. So my passion or my what drives me is the desire to see change, to contribute to change. And of course, as a history, as Rwandans, we have been refugees before. We have been disputes who have moved from place to place because of circumstance, and we've not had access to some opportunities growing up because of where we grew up, what we went through. So talking to the older generation, I think I can call it, you learn about that suffering. And that suffering, even today, there's still some suffering in the communities that we live and the people that we engage in. So for me, what drives me is those stories and that desire deep inside me to contribute to some sort of change. That's really inspiring. As a communication person myself, I really being Rwandan it fuels most of the things that I do. And every time I think about work, communicating people's stories, documenting them, it always reflects back to being Rwandan in some way, somehow, which is amazing. So literally kind of the same question I just asked. When did you first realize communication wasn't about saying something but moving something? You talked about impact. So how do you connect it to saying something, but then also you're saying something but then you want to move something? So when did you first realize that about communication? I think I realized it early on in my life, where I grew up, or the schools that I went to. Communication was always a big deal, and we had school clubs that promoted that kind of dialogue. There is a club that I used to be in all my younger years that was called Interact.
Yeah.
So you were supposed to interact with
Uganda.
others. This is in Uganda.
Okay. Yeah.
So in this kind of club, you would enter and learn how to network and learn how to introduce yourself.
Yeah.
And the whole reason behind this was so that you learn different skills that you also learn in school,
Yeah.
right?
Yeah.
Like public speaking and taking that fear away.
Yeah.
And also the message, you know, when you want to communicate something and make your message heard, you have to adapt it to your specific audience.
True.
So, you know, in school it was through the clubs and it was through, you know, that interacting and the music and maybe dancing, and you would communicate your emotions through that. And that kind of inspired me to be like, I want to be part of the community that now takes the message and are interacting not only in the small group but to the globe and to the world, and kind of expand its reach. And I knew I could do it because I was one of the people that is trying to change the culture in the club, how I found it, how I want to live it, and I think for me that is what showed me that communication is much more than just saying something, but you can now go and contribute towards some impact and transport that message in different styles.
Yeah, that's really good. I feel like you have a very great background for you to rehearse what, you know, like about, and it sounds like you're a very vocal person as well, because that's really cool. So Arnold, now we're getting into the actual, you know, part of the podcast where you tell us about the mission that you serve, SFH. Maybe you could just tell us a little bit about SFH. And I believe this is me speaking from a very non-health background. But in public health, the wrong message cannot only, it just doesn't cost money, but it costs lives as well. So when did you first feel this weight land on your chest? And maybe you can first tell us about the mission that you serve exactly, and then after we'll get into how you felt like you're the right person to communicate this heavy and very quite impactful messages to the community, and not only to the community but also to the world, because it's a problem that almost everyone in Africa and all over the globe is facing. So yeah, maybe you can first start with that before I overwhelm you. The mission that you serve and how you first felt like, yeah, this is right, this is where I belong, you know.
Yeah, thank you. So SFH is a local non-government organization, non-profit, that operates across the 30 districts of the country, majorly targeting those areas and those communities that we can categorize as underserved. So what means that these people that are the end of the services, right? So what we do is that we primarily focus on enriching their lives through different interventions, through different products, and through different services. One of the ways that we impact people's lives in Rwanda is through, like you said, behavior change communication. So like you said, public health messaging is focused on changing people's behavior from maybe a negative behavior or a negative situation to a positive situation and through a positive solution. So this messaging is to maybe awaken them, to advocate for change, and we work across different health areas. For example, we work in family planning, where we have be it the behavior change, where we want people to realize that planning and for the number of children that they want to have, or even the uptake of services that is there. When we do some of our researches, we realized the uptake is low. And another health area is malaria, where we contribute to the different ways you fight malaria, collaborating with the government, and we have also some other areas like cancer and health system strengthening. So the way we contribute, we do social behavior change, where we go to the communities and we teach them, be it sanitation and hygiene, malaria, family planning, and what are the best practices,
Yes.
right? And we also have products that accompany these messages. Not only do we teach you what should be done and what is correct by national and international standards of hygiene and all that, but we also give you the products. And we give you the products, sometimes we give for free, or sometimes we even add a small cost to it so that someone can really value what they receive. Another way we impact the community is through system strengthening, where we train healthcare providers, but we also build infrastructure like health posts that then serve these different communities that are otherwise underserved. So that's basically a sum of what we do. We do so much more. But to your second question, how did I realize that I can contribute to this mission of empowering people and changing their lives? So I joined the SFH as early as 2018, and I had heard so much about SFH. I was from serving in an international organization, but I wanted to contribute more with the people, right? I found myself wanting a touch of the people and to be near them and to listen and to be able to be their voice. Right? So not everyone has the chance to go in front of camera or to write some story for themselves and to be able to put it out there, but that's something that I can do. And I can take those unheard voices in the communities that have a story to tell, that have a message, that have a transformation that they wish to communicate, so that others maybe can learn from that particular message. So my calling is every time I'm with people, I'm in those communities, I learn so much. I heart, I feel for them. So I want to take those feelings and those messages and turn that into a powerful story that can change someone else's life. Because when we get these stories, sometimes we do take them to the other communities that haven't had the chance to maybe interact with this message and see if a testimony from a person they see themselves in can change the way they perceive or the way they act. So when you do that, when you transfer that message from maybe one testimony and take it to another community, and you see someone saying, oh, now that I relate with, that I have been that, when they give a critical example, say, oh, that happens to me as well. So when you see someone having like that click, and they click with the message and with what you were telling them earlier, and then they implement, you realize that when the change is happening, you're seeing it, and maybe when you come back after a month or two, you can see it for yourself. So when you see it for yourself and you had a hand in changing this person's life, maybe it is in nutrition, and they do not know what a balanced diet is, right? Because most people that we serve are farmers. They have all the food, but they don't know which food is eaten how, in what quantity, right? How many times, what is important, what does what contributes to this. So when you teach them those things and now they pay attention to them, and you find that a child who was in red is now in green because of the messages that you've brought to them and the way you've interacted with them and the lives that you have changed, you really feel fulfilled and believe that the mission that you're serving is the right one.
You talked about empathy, and one thing, I believe in everyone having a voice, but unfortunately, everyone has a voice here in Rwanda, but then unfortunately not everyone is able to voice it the way they want to. And I would want to ask you, how do you bridge obviously the gap is there, but then I'm thinking about how you come from empathy, like how do you exactly document someone's story? Like, do you sit with these people, especially because sometimes I don't believe every time, maybe you can correct me, sometimes it's you're documenting stories, from people in the rural area, but then you also want to tell the public what exactly you're doing. So how does your messaging change? How exactly do you work with messaging, and from like maybe even from the urban areas to the rural areas, or from the rural areas to the urban areas? How do you create this common thing where we can all relate to it and understand what's going on and what you're doing, or if you want to change someone's life? I don't know if I'm messaging this correctly, but yeah.
No, I think you're spot on. I mean, the way the message gets from one point to another, it doesn't happen. Yeah, it takes it has a life of its own.
Yes.
So I mean, with SFH, we work closely with the government. So every health area, every topic, the government has set forth a kind of a messaging guideline for the correct and let's say the way all of us in the civil society, be it government, be it civil society, should and should be guided by this messaging, right? So when you're going to create that type of message, you take into consideration what the country context is. You take into consideration what the audience is, because even the message depends on the audience, and you also take into consideration what you want them to do after, right?
Yeah.
So you need to know who your audience is, and you say, okay, so these people, this is their lifestyle. So if you're going to talk about malaria and fighting malaria within a certain community, for example, these people are maybe rice farmers, right? You are not going to just tell them to maybe use a mosquito net. No, you're going to tell them, yes, when you're at home, in your house, in your bedroom, you can use a mosquito net. But even when you're out there working, there's other tools that can help you in your work. So and you bring it to what they matters to them. Because if you tell them that when you're sick, you miss work. When you don't work, you don't make money. You don't make money, you can't eat. So if you get this tool that will help you not miss work and protect your life and your health, so that you can make money 30 days in a week instead of 15, is that beneficial for you?
No. Right?
So I mean, it's that kind of understanding where your audience comes from, right? It's putting yourself in their shoes and understanding that this message that someone is giving to me, what will it actually improve in my life? Unless it has no value. But if it has value, a human being, someone out there, someone suffering, someone who has gone through maybe this illness, is going to value that message. Because he's going to say, oh my God, maybe this is the way I've been living. Maybe let's say HIV and AIDS. I haven't really been protecting myself. These are the, especially with the youth. Now we've gone back to audience. The youth, you're not going to just come and say, oh, here's the product, go use, right? Now you're going to say, maybe, do you know the number of teenagers who drop out of school because now that they are pregnant and now they can't take care of the kid and they have to choose where to work, and maybe they should have gone to school, but now they are taking care of a kid and they lose so many opportunities, and look at your friends, and do you want to be like this and like that and like that? So you really have to take it home. You have to take the message home, sit in that person's shoes, ask yourself, like, if I was 16, what would be like the thing that motivates me to maybe change my behavior? Right? And that's why maybe even some of the approaches that we have begun to go into, like using digital tools with the youth, is because this is where the journey is also taking the country, and using digital tools to improve and to transform lives. So with the children today, maybe in HIV, no one wants to sit and read a book about AIDS and stuff, but they can go online and as they're playing a game, learn some information. Right? If you put a game, an interactive game that they can play, and when they win a puzzle or something, a message comes in, they retain it, it asks them to fill in some things, maybe it's objectives. That's a new way of learning that you have to adapt to, because of so you really have to put yourself in the shoes of the people that you're serving.
And while you're talking about this, one thing that clicked into my head is like teen pregnancies are growing every day. Like people having like young people are having babies left and right. And I do believe you guys, as a communication person who actively works in this, who sit down, has conversation with these people, I feel like sometimes it gets frustrating. You're like, what else?
What aren't we doing?
What else? Like, okay, now you have to sit down and think about another strategy.
Yeah.
And let's say in a world where you were given the best digital tools, what exactly would you do? Or even now, what are you doing? And what is the best way to like create like a, because I remember when we were growing up, we used to see this advertisement on TV, like this is like a condom, please, this is the way to, like, this is a way to use it, don't have unprotected sex. Like, these were things that were actively like being talked about. I'm not a very big TV person, so I wouldn't know what's going on on TV right now, but I do believe that there is just a significant reduction. Maybe was it because it wasn't working? Was it because this was still under SFH even back then? So I'm wondering, like, what exactly is being done to significantly like reduce this? Because obviously we don't have control over the people wilding and whatever, but then there is a way you can do it maybe. So maybe you can share strategies, like what is the best way maybe to communicate this, or in a world where everything was perfect and you were given all the resources, and what would be the best way to communicate this and to significantly reduce teen pregnancies?
Yeah, thank you. So I mean, I don't think there's like a one thing that we can do to kind of fix the problem. I think depending on the context and the reason you're implementing and where you're implementing, because also different districts have different challenges, so does regions and countries, and so at SFH we really put a lot of resources into fighting teenage pregnancies, since we are really looking at improving lives, and one of the groups that we are looking at to improve the lives and to reduce such outcomes like teenage pregnancies is quite disheartening, to see a 14-year-old, a 15-year-old that is caring for a child. Them themselves are children, and now they have the responsibility to care for another child, right? They haven't grown, so what are they really going to do for this child? So I mean, we implement different interventions at SFH that contribute to fighting some of these issues. One of them that we do is in some of our programming is something we call the parent-adolescent communication. When implementing, previously, like you said, SFH has been implementing programs for 13 years now in Rwanda. We realized that there is a disconnect, right, between what parents want and what children need. Right.
Speak about it, parents.
I'm not attacking anyone, but there was a disconnect in what parents want and what children need. So parents growing up in the traditional sense, themselves never received a formal education on reproductive health. Neither did they have these conversations with their parents. So they had to learn the hard way.
They could only give what they had.
Exactly. So if you're not comfortable talking about sex with your children, obviously your children, although they need this information, they really need it, but they're not getting it from the most trusted source, which is parents, right? No one has your best intentions more than parents. So if your parent is not giving you this information, you go to your friends, to your peers, right, who are not any more informed than you are. Right? Another place we were finding people going to, apart from peers, was the internet. The internet is so broad that it gives you so many things that it's hard to know and to distinguish at that age what's true and what's not, what's for your age and what's not for your age. So and then there's movies and things like that distort reality and factual and information, and then there's hormones that children are going through and they don't want to listen, maybe they're having tantrums and stuff like that. So we realized that getting these two groups, the parents and the teenagers, into a room where we could dispel this myth and misconception that sex and talking about sex is a taboo.
Yeah.
We would now start to break barriers in access to information, access to product, access to services. So when we get these groups in a room, we tell parents now, this is the way you should talk to your child.
Yeah.
You need to listen. It's not only you talking. They even have things to say. Give them time. Allocate a time in your week and say, me and my children are going to talk. I'm going to talk about sexual reproductive health. I'm going to talk about drug abuse. I'm going to talk about addiction. I'm going to talk about different things. It doesn't have to only be that. You can incorporate that time and think about it even before and go and inform yourself. So we gave these parents some tools because they didn't have this information as well. Give them some tools that they can study, that they can ask questions within themselves, and then expand their knowledge. So that when they go to have conversations with these children, they actually know what they're talking about, right? Because everyone has a different experience, be it with information that they've learned from their lives, be it with product, because even product is different. It's a wide range of product, some with effects, some with not, and services. There are so many services outside here that are meant to be used by the youth, but they do not know they exist, or they do not know that they're there. So you have to encourage and to bring all these people together through those parent-adolescent communication sessions in the areas that they live. Because you're also not going to tell them travel to Kigali, travel to the city to get this. So you go to them with this messaging, with written messages, audio messages, just whatever is comfortable for them. And you can give them, you can even talk to them and tell them at this hour, at this programming on radio, on TV, there will be this message passing through. Anytime you feel you want to go and access it. So that's just one way. Another way that we contribute to these positive outcomes and reducing teenage pregnancies is through a digital platform that we created with our partners from Y Labs, that's called Cyber Rwanda, that gives them age-appropriate information. So this age-appropriate information is accessed through a web link that they can go and read, be it stories that educate, be it ask a question, because they have access to these like almost like nurses, virtual nurses, where they can go and ask questions they would rather not ask their parent or their teacher or even their friend. So that virtual access to asking, you know, an online nurse or peer, because we also customize them in that way, gives them that liberty, they give them that freedom to be free and to ask what they really need. So those insights help us even design better programming for the website. If we get to know what type of questions that they're asking, because we also compel them to maybe share with us their age, so we see which age group is asking which questions, and then we tailor more stories or dramas depending on that. Another way that we impact you know, these outcomes in reducing teenage pregnancies is through creating safe spaces like youth centers. So youth centers, in the traditional sense that was being created by the government, is a place where children can go to spend their free time and to learn and to play. So we said, okay, how do we improve this? How do we improve the facility? How do we train some of the providers there to give better access? How do we provide product? Because if a student or a young child, a young adolescent cannot pay for a condom at a boutique, because it maybe buys 200, 500 shillings, Rwandan francs, and maybe they can get it for free at the youth center, right? Because at the youth center, you can have access to the product. SFH has condoms that it distributes to these youth centers for free, and to health centers and hospitals and health posts. So they can go to this place and access these services. We also empower, you know, the nurses at the youth centers with tools and trainings, maybe that they can distribute to these groups. Like some of the newer tools we have, maybe we have some HIV self-test. So sometimes you're afraid that the provider won't keep your secret.
True, yeah.
So maybe you are more comfortable with getting a self-test kit and going home and using it by yourself. So that self-test kit is also another way that we're encouraging testing for HIV. Because the earlier you test, the earlier you can get some help. So those are some of the ways that we're trying to change the narrative and to reduce these teenage pregnancies. But it's all a collaborative effort, and we work closely with the government and with our partners to make sure that we have access to these products, we have updated information, we can expand our reach, and
so especially because you work in the rural areas, and this is where most problems are, because these people are not exposed to they don't have access to information, they don't have access to product, like you said, and they don't have access. I believe the rural areas, it's very community centered. So they used to say ufata umwana wundi nk'uwawe, which means that if your aunt, maybe like your neighbor, is the owner of the shop, they have condoms, it will be very hard for me as a neighbor to go and say, Tantine, can you give me a condom? Which is very hard. So how do, there's some certain narratives and mindset that these people have that you have to go against. Even maybe let's say it is non-core people in the rural areas. Most of the times that's why you guys brought family planning. A lot of kids, and they can't be able to maintain them, because of the poor livelihood. They're just let's produce as many kids as we can, and then we can focus on something else. I don't know maybe you have communicated with them, you would know. So how much energy does it take? Because these people have grown up seeing their parents, their what, it's something they've grown up seeing like that. So I believe it takes so much energy to go against these certain things that have been said there, this is what you do, this is what you follow. So how do you go about it? You touched a bit about it, but now I want to understand how exactly do you sit down with this people and tell them, this is actually very wrong, and this is what you have to start doing. How you can. I would love to know the process as well, and also how you do it. How is it? I feel like it's very shocking to be this is my life, and you're bringing a very new thing of now I have to do family planning. Now I have to, I can say no maybe to my husband if he wants. How do you actually how do you destroy one narrative and actually bring another one? How is it, and how do you do it?
That's a really great question.
Yeah.
So, behavior change is not something that happens in one day. It takes a while. And even as a communication enthusiast or professional as yourself, you also know that communication is not just done once. You have to keep on communicating the message. And there's so many avenues for communities to buy your message. One day it has to actually work. Right? What you're telling them, it should be evidence-based, right? You have to come from a point of, it has worked here.
Yes.
It has worked for these people who are in your condition, but then they took this step to adopt this behavior and now look at their life. So we talked about it, there's testimonials that you can use to influence these communities. Because if they see someone just like them, who lives and does what they do, is a farmer, for example, is a teacher, is a bike messenger, is a motor, is all these things that they are as well, they are more likely to adopt that behavior because they've seen someone like them. Right. Another thing that you will really tap into is these local influential people. Right. So when you go to communities like these, you find out, just like anywhere in the world, even here in urban areas, that we have someone that we look up to, right? A local leader, someone who can influence how I think about something. So we engage these communities. We go, we talk to the district representatives, we talk to sector representatives, we talk to village representatives at the Omodugudu level, we talk to everyone to kind of come on board, and we start with them. We say this is the direction that the country is trying to take, and SFH as a partner of the country, as a partner of the Ministry of Health, This is why we are trying to push this agenda, because we're trying to help reduce maybe or contribute to this indicator of, a lot of families that are suffering from poverty because they can't really manage the needs of their family. So this is the approach that we are taking. Please, do you want to come on board? And obviously, as the culture of Rwanda, everyone wants to contribute, and they're really enthusiastic about it. Of course, you cannot fail to find those people in the community that are like,
hell no.
Listen, you guys are coming to kill us. Maybe, or you guys are, you're bringing all this modern and foreign stuff, yet we know how to do our things.
Tradition has always worked for us.
But you take it slow, and you don't come with a pace. You just say, okay, that's how you feel today. But let me catch you next Tuesday at the Umuganda, or I get you at the Ineko Yabaturaje, where they meet sometimes, and I'll talk to you again. I'll be there. And then you show up, and he really wasn't expecting you. And he said, you come back. You're like, yes, I won't leave here until we have a proper conversation. So it takes a lot of dedication. We have staff at SFH who have been on board for a number of years, over 10 years. And these people really know the community. They know they've been part of the community. They've been part of the change, because Rwanda today has really improved in terms of outcome. This is not where we started. And we're slowly getting there. We just have to be consistent with the message, maybe be innovative with our approach. For example, we talked about, SFH is partnering with different partners, including Mastercard, to kind of innovate the way now the youth have access to these products. Now they're taking it in a digital sense. They're going to have a digital platform where the youth can access these products, and they can be accessed easily and affordably, and kind of reduce the access challenge and mitigate what you are saying. I can't just go next door and say I want a condom, Papa Ahmed. There is no way. So I would rather just go and do it. But then, what are the consequences of just doing it, right? So if you are present in these communities' lives, because SFH really works within the community. We have 5 district offices where we have a chain of volunteers, and we have a chain of partners, and we have a chain of staff, and we really live in these communities. So they know us, they trust us. Once they trust you, they know you, they know what you sell works, or what you talk to them works. So like you care about them, and you're not just coming to complete a mission and run away. When you've built over time that trust and that relationship with your communities, it becomes easier to implement, because they know that you're here for them, and they know that you are trusted, and that you collaborate with the local leaders that you've brought to these meetings. So they want to try, even if they don't know it's foreign. You're talking about something they've never seen. But because they know you and they trust you, just like your best friend can come and say, hey, have you tried this drink? And you're like, I don't even know what's in it, but let me try because I trust you. Same thing.
So more of relationship building, I would say. That's really nice. One other thing I was thinking about, SFH is a really cool organization, and I believe in what you do so much. And I was making my research, and your partners are really, really, really big. And I'm wondering, how do you get a story from a nurse in Bugesera who is doing HIV counseling? He's talking to these people, he's saying, ntabwo birangiye, even if you have HIV, what, or even convincing someone who is so convinced they have HIV, even though they haven't tested. But then, you try and tell them, you try and see, and then after we can mitigate whatever is going on in your life. How do you make that story and communicate it to someone who is in San Francisco, who is in New York, who is in, how, I believe it takes a lot. So this is such a learning moment even for me as a communication person. But take me through how you make the stories matter. I think I would understand because I'm Rwandan, because I do travel sometimes. I see how people are doing in those areas, but some people have a narrative of Africa that is crazy. So how do you make, already there is already a narrative that Africa, we are poor, we are what, and obviously sometimes it's yes, we're not poor, but then we have so many things that we have to work on, which we're working on, and it's really working great. So how do you tell this people, yes, we're doing this, we're Africa, we're doing this, but we're not, like, how do you position yourself like you need help, but then you're not vulnerable? Like, I'm trying to understand, like, you know, like, how do you do this? How are you making this story from someone in Wijesera who is struggling, or in Karongi, whatever, and make these stories matter to people who are in San Francisco, people who are in, you know, like, different places other than Africa, without also making us look like, you know, we need help? Because I'm also going to touch on that a little bit, but yeah, please go ahead.
Yeah, so I mean, that's the job, right? That's the job.
Yeah.
That's the job. The job is to make stories that touch people.
Yeah.
So that the people we are talking to can relate. Yeah. Can relate with the conditions that some people around the world face due to different inequities that you said we shall talk about. Yeah. So access to us as a Society for Family Health believe in access, right? We believe in access. So our whole entire mission, when you look at it, is bringing access to these people. Yeah. So for us to do this, for us to be able to bring access to these people, we work with different, like you say, different partners around the world. Yeah. And these different partners also have a mission, right? You know, we can talk about the likes of Bill and Melinda Gates. We can talk about the Buffett Foundation. We can talk about all these people's intentions, and their mission is to improve. Maybe different, they're looking at different indicators and different health areas, but in general, is to improve the lives of the world. Yeah. So at SFH Rwanda, we believe at, you know, delivering the last mile of care. That means the person at the end of the line, you know, the one that lives behind the hills, right? Is the one we want to get to. Yeah. So that's how we communicate at SFH. Yeah. This is who we are. We want to help you contribute to the mission that we share. Well, that's a shared mission. Your mission is our mission, right? Your mission is our mission, and we are already there. Yeah. Right? Yeah. We're already working in that space, in the last area, in the last mile. Yeah. Why don't you let us work together so that we can work quicker, we can work more effectively, we can deliver the goals that you want to deliver, but also help our people, because we are working for Rwandans. Yeah. So how do we bring your interests, align them with our interests, especially since SFH is one of those organizations that's very transparent. So we don't even we don't even need to work as hard because the stories are just really there. Yeah. You just need to go and bring it and say, oh man, this is Marie-Ange. We were chatting, this is what she said. Right? She said that before, this is what she was going through. Yeah. She used to walk 5 kilometers. She used to walk 30 kilometers, 5 hours. There's a story I went to one time to collect, and the lady told me I walked 7 hours, pregnant, 9 months. Wow. 7 hours is literally a drive from here, I think, to like Tanzania.
Insane.
That's just, and I almost cried listening to this, because she was saying, you know, my husband is not around. He went to look for work somewhere. I live alone. Even my parents live somewhere else. I had no one to help me. It was dark it was the middle of the night. At maybe at 1 a.m. I walked. By the time I reached, it was morning.
This person is in labor.
The person is in labor. Another person tells you, I walked the 4 hours. I got tired, just delivered on the road. And that was, you know, that's all she wrote. Yeah. So, you know, for me, it's not even about, it's the job to tell these stories, but it's more about, do people know? Do people even know that these people are going through this? Yeah, yeah. So personally, it's just about using the spaces that are out there, you know, be it social media, be it TV, be it radio, be it the website, to be able to let people know
Yeah.
that there's people out there who need our help, who need us to show up,
Yeah.
who need us to execute,
Yeah.
who need us to be efficient,
Yeah.
and to get them that access. Because all they need is that less than 30 minutes walk for their lives to change.
Yeah.
If a kid in the middle of the night has to wait until morning, because a kid under 5 is not going to do that 7-hour journey.
Yeah.
So they're going to have to wait till morning
Yeah.
to maybe get transport.
Yeah.
That transport might find when it's too late.
Yeah.
How do we mitigate
Yeah.
those outcomes? How
Yeah.
do we reduce the kids who are under 5 who are dying
Yeah.
just because they don't have access? How do we bring access? And that's why, everyone who works at SFH is
Yeah.
passionate about
Yeah.
access to
Yeah.
healthcare.
Yeah.
And that's our mission, is to deliver that access,
Yeah.
but not just access,
Yeah.
quality access, right? And whatever helps us meet that mission, be it a partner, be it a tool, be it some collaboration,
Yeah.
or whatever opportunity, we shall take
Yeah.
it.
Yeah.
Yeah.
That's really, I've always intended to share this story, but thank God for this platform.
Yeah.
Recently, maybe let's say 3 months ago, not too recently, I fought malaria, fighting for my life. I was so sick, and I was at home, and my dad was like, you know what, let's just go to a health post. And the service there, I was like, first I was hesitant. I'm like, you know what, like, what do you mean health post? Can we just hit a hospital? That was what it was in my head. I'm like, yo, like, are you sure?
Yeah.
For me to get there, and I got the most exceptional service in like 3 days, 3 to 4 days. I think for the time they prescribed the medicine for me, I was okay. And surprisingly, I get a call when I'm back at work, and they're like, hi, how are you doing? Are you okay?
Wow.
And I'm like, SFH is doing big things. So
a real life testimony.
A real life testimony. I'm giving you.
Go to health post today.
Right. Yeah, so this is actually not a story Arnold is just telling you. Maybe that the pregnant women and everything, that's a bit, but even me, I live in like the sides, and I still had to it was the nearest, and I still got the best services. So really doing big things. So thank you so much for communicating this stories, and impacting people's lives literally. Yeah. So we've talked about partnership a lot, and one partnership that stands out to me is with Sand.
Yeah.
And I do know what you guys do with Sand, but then maybe the public doesn't know, people who are following us. So I've heard a lot about the Blue Room. The Blue Room. I don't know if it's actually blue.
It's blue. It's blue.
Yeah. So can you please tell us what the Blue Room is, what it does?
Yeah.
It's aesthetic. I know it's about aesthetic, dashboard, what you tap into it. But then, tell us, what do these aesthetics help? Is it risk mitigation? Say, is it what purpose is it serving? Yeah.
Yeah, thank you. So Sun Technologies is a partner that we've been working together, I think, for over 2 years now, or less. So really what we're doing together is trying to transform how primary healthcare is delivered in Rwanda, but also now we are partnering in South Sudan.
Yeah.
So Sand in its abilities is a system integrator that takes companies or organizations like SFH and looks to where their bottlenecks are in terms of data, in terms of systems, so that we can optimize the type of service that we deliver. So at SFH, we're really interested in innovation and tech-enabled healthcare, and that's what Sand is helping us to do, is to be able to take this data at health posts and now kind of be proactive about it and not just reactive, and try to plan ahead and that's what the Blue Room is there for now, as a centralized hub that receives all of this data from all of our health posts and aggregates this data to help a certain cause. For example, many years have gone by where SFH is implementing our agreement with the ministry to operationalize and to help these health post functions at capacity. So along the way we realize we are losing so much time in collecting this data and time analyzing it and time responding to what we found. And what the Blue Room really does is give you these analytics in real time. Right? So you are seated in this room, it's blue. It's really blue, and we are in this Blue Room as different partners. There's someone from eFish who created our EMR that we use at the health posts. There's someone from SAND helping us, bridge these systems, be it the eFish, be it the SAND systems, be it the IoT sensors and the fridges and the geolocators that tell us where the next health post is going to be placed. And there's so much that SAND is doing in creating these tech-enabled systems. And of course, we are taking a lesson or a page out of the national book, which is to transform sectors, right? Healthcare is just one of them, but sectors to perform better, to reduce the losses that we are also incurring in the management of health posts. So SAN really, is helping us do all of this and so much more.
Wow, this is a very interesting conversation. I have, I've learned a lot, but as we come to an end, because I don't want to we'll definitely do a part 2. But what part of your job, if done right, could literally save a life tomorrow?
That's a good question. What part of my job, if done right, can save a life? So I think a big part of what we do is creating awareness of the real issues on the ground. And some of our work actually creates partnerships. Right? Because if people they see that your mission is shared with their mission, they want to come on board. And if you really tell the story the right way, it can develop a partnership that then helps the person at the end of the last mile. So I think part of my job that when done right is awareness. Right? Being able to package the needs of the community into a language that the donors understand, that the funders understand, that the partners understand, means that they are more likely to want to reinvest in the program. Because if they can see who it's touching, they're like, but we don't want this to stop. And that's something that you now see, that we're taking kind of a step back, because there's so much funding that's being taken away from areas that we're operating in. That this kind of awareness is the only thing that can now kind of challenge that funding that's being taken away. Because people now have to step up and bring more of these stories. So the funders who are taking away money realize that it's not just taking away money, but it's also taking away lives. Because that money is impacting change that if we don't have it today, someone is going to die because they don't have maybe this service or this product or this information.
Quite literally,
So I think for me that's the part of the job that we need to put some more effort in awareness that can remind some of our partners or people working in this space that this money is just not dollars and figures, and it's not a statistic. It's someone's life who depends on this product. It is someone who has been battling HIV for this long time, and this medication, if they don't have access to it, they're going to die. It's someone who was waiting on a new borehole that was being built that now is no longer going to be built, and they're still going to have to drink dirty water or walk 8 miles to access that clean water. It is this mother who is expecting some immunization for their child, but now won't be able to get it because this partner or this organization has taken away the funding. So I believe in comms, it's up to us to remind people in the world that these real families, real communities that are being affected by the reduction in funding, and that people are going to die if we don't do something about it.
So I hate to be that type of person who keeps on saying as we come to an end, but Arnold is really speaking some facts here. And one thing that you just talked about was funding. And allow me to go there. Allow me to go there. Let's go there. After the funding and everything cut, how much because the landscape in public health is quite dependable, especially like you said in SFH, most of the things that we do are supported by the government. Like you need support, like you rely on support, even like telling these people you rely on them to actually listen and put into practice what you're asking them to do or what you're advising them to do. So how key do you find public health, especially people who are in public health, to be sustainable, like to be self-sufficient, especially after what just happened? It affected so many people. So how would you talk about the landscape in public health and sustainability? Just just your opinion, doesn't have to be that deep, but
I mean, it's quite possible. I think at SFH we're already trying to be a proof of concept for this. We are driving what is called the nurse entrepreneurship model. And what this essentially does is give nurses and at the primary healthcare level access to resources and facilities and training to be able to turn health into a business, right? So this health post does not just function as an infrastructure where people can come to get services, but it also helps the people working there to make an income. If this business is given a startup capital, is giving the necessary trainings, the infrastructure is already there, they are given agreements to have medicine, be able to access medicine and to be able to pay, and be given these digital systems that can help them track how they spend and what they are treating, and to be able to track their patients and also to predict epidemics and stuff like that. It gives them a lifeline. So we've already seen this because we've invested in health posts and collected this data and being able to prove that if you get one nurse who wants, who has the passion, and you equip them with a facility, you give them a health post that is well equipped, you give them the training, you help them with business management and business acumenship, and so they can understand that this is not just a service provision, but also they need to make a profit. You allow them to recruit their own staff, and you just be there to support. After 6 months, we started to realize that after this facility has been given all that, it does not need us anymore. This person is going to be able to pay salaries of the people that they employ. So they're all going to be able to feed their families. They're also going to be able to give those services, especially the expanded services that we have added to health posts through the second generation health program. And you're going to change these communities. You're going to change these people, the staff that are working there, even around the health post. Right? There's services that are now in need. There's going to be housing services because those people need where to stay. There's going to be restaurants because they need where to eat. There's going to be Irembo services because they need where to register their newborn babies. There's going to be someone from Me to You because it's a whole ecosystem that is built around one health facility. So I think in terms of public health, it is possible to be self-reliant. We just need to be able to put up that access to capital where we de-risk some of these loans, and now this healthcare provider can go and do what they want to do and what they're passionate about, and not worry about, you know, such a big maybe percentage that they have to pay back. And just know that all I need to do is run this, and then after that I will start to make a profit and maybe open another health post and stuff like that.
So as we're coming to an end, the mic is literally yours. I know that you, anyway or anyhow, your voice to be out there for you to communicate a message, especially to people who need to hear what SFH does, is very crucial to you. So I would like to give you, feel free, and just send out a message that you've been holding on to, or maybe the one that you always want to repeat, one that is such a myth in in health communication in Africa. Whatever it is that you would like to communicate, the mic is yours.
Thank you so much. So first of all, I would like to thank you, Muiza, for inviting me to your podcast. It's really been eye-opening and a great conversation to have. It's great to see that Rwanda is expanding its type of communication. Podcasts are not something that have really yet been integrated and professionally anyway. So it's great to see that there's different places where we can have these conversations and be able to contribute to our country in a positive way. So I mean, my message, I think, is just a message of hope that everything that Rwanda is doing today, it's so that we ourselves and generations that come after us can have good and healthier lives. So SFH in its structure believes that no one anywhere should die or suffer or because they don't have access to services, access to information, access to product. And that is our entire mission, is to inspire healthier lives, to optimize primary health care, but also to work with others to be able to achieve our mission. So if you're out there and trying to impact primary health care, SFH is ready to work with you, and ni karibu.
Well, thank you so much for tuning in and choosing to spend your time with us. Thank you so much, Arnold, for making time, and we can't wait to have more people from SFH talking about stories and how much you're impacting lives. This was very, very eye-opening, and thank you so much for the work that you do. And this is why we create spaces like this, so that people who are creating change and impacting people's lives can have a platform where they can speak and express how they feel and the challenges they're facing, and this is what it means. Actually, the spaces you're talking about, these are one of the spaces. So thank you so much. It was very amazing having you, and thank you. Have a good one.
Thank you too. Thank you so much.